Therapeutic Modalities. Introduction. Therapeutic modalities create an optimal environment for injury repair, do not cause healing. Most common types of modalities: cryotherapy, cold; thermotherapy, heat; massage; electrical stimulation; therapeutic ultrasound; physiology basics: vasodilation, vasoconstriction; increased size of vascular structures means more oxygen to the tissue. Vasoconstriction, decreased size of vascular structures, useful for preserving compromised/injured cells/tissue. Physiology basics: analgesia, metabolic rate, inflammation; diminished/reduced sensation; metabolic rate, activity level of cells. Reducing MR can preserve cells damaged by injury. Inflammation, series of events that hinder optimal function. Cryotherapy, ice, physiological effects: decreased local metabolic rate. Important in preventing secondary hypoxic injury. Decreased local blood flow. Vasoconstriction, decreased presence of inflammation and the processes of inflammation. Cryotherapy, ice, physiological effects: reduced swelling. Decreased nerve conduction velocity. Analgesia, pain decreased. Cryotherapy, ice, indications: acute injuries after activity, swelling, spasm, pain, mild burns. Cryotherapy, ice, contraindications: hunting response. Prolonged exposure to cold may lead to superficial vasodilation to protect cold body part. Raynaud's phenomenon. Cold allergy. Cryotherapy, ice, application: ice massage 7 to 10 minutes. Excellent for muscle spasm and deep soreness. Cryotherapy, ice, application: ice bags, ice towels, or cold packs. 15 to 20 minutes, no longer than 30. If using packs, be sure to avoid direct contact to protect skin. Cold whirlpool, ice immersion. 5 to 15 minutes, 55 to 65 degrees. Duration and temperature depends on surface area immersed. Thermotherapy, heat, physiological effects: increased local circulation. Vasodilation, increased local metabolic rate. Increased collagen extensibility. Increased nerve conduction velocity. Analgesia. Thermotherapy, heat, indications: contraindications: subacute injury. Prior to activity. Reduce spasm/guarding. Contraindications: acute injury. Impaired sensation. Thermotherapy, heat, application: warm whirlpool, contrast baths. Treat 15 to 20 minutes, no longer than 30. 98 to 110 degrees. Contrast baths. Switch back and forth between hot and cold 3 to 1 or 4 to 1 to induce vascular pumping action from repeated vasodilation/vasoconstriction. Particularly useful for troublesome swelling or edema. Thermotherapy, heat, hydrocollator packs. Treat 20 minutes. 150 to 160 degrees. Will burn. Must pad with layered towels or covers. Thermotherapy, heat, paraffin bath. Great for angular extremities, hands and feet. 125 to 127 degrees. Wash body part. Dip body part 4 to 5 times, then wrap in ice bag and towel. Treat 20 to 30 minutes. Dispose of wax or return to bath for reuse. Do not use with open wounds. Massage. Physiological effects: indications. Increased local blood flow, if done properly. Increased venous/lymph return. Analgesia and sedative neurological effect. Indications: subacute injury, soreness, persistent swelling. Massage contraindications. Acute injury may disturb clotting mechanism. Fracture sites. Open wounds. Types of therapeutic massage. Effleurage. Petrissage. Tapement. Vibration. Cross friction. Effleurage slow, rhythmic, soothing strokes toward the heart. One hand always in contact with patient. Use massage lotion or cream, gloves optional. Helps calm/soothe athlete. Encourages venous and lymph return. Petrissage deeper kneading of large muscle masses. Stimulates local circulation. Eliminates muscle trigger points. Tapement percussion, cupping, or hacking of the large muscle groups. Typical health spa massage. Invigorates, increases neural response. Increases local circulation. Vibration, rhythmic oscillations of larger muscle groups. Most often quads and hams. Physiologically speaking, we are not really certain of its effects. Perhaps largest benefit is psychological. Cross-friction, best empirically supported technique. Increases local blood flow. Reduces sensation of pain. Accommodation. Useful in restoring full function in ROM. Typical treatment lasts 5 minutes. Electrical stimulation. Many types available. Transcutaneous electrical nerve stimulation, TENS. Useful for pain relief. Portable units are very affordable. Typically treat for 20 minutes, electrical stimulation. Many types available. Interferential quadpolar, IFQP. Uses 4 pads. Good for pain control. Premodulated bipolar, PMBP. Uses 2 pads. Good for pain control when IFQP not ideal, small body parts, etc. Electrical stimulation. Other types also available. Settings. Higher frequencies tend to produce fast-acting, comfortable treatment for acute injuries, while lower frequencies tend to elicit longer-lasting relief for chronic injuries. Typical treatment lasts 15 minutes at intensity of comfort for patient. Therapeutic ultrasound. Sound energy which results in deep heating to tissue. May penetrate up to 3 to 5 cm when administered at 1 MHz, up to 1 to 2 cm at 3 MHz. Must keep ultrasound head moving to prevent burns. Typical treatment lasts 5 to 6 minutes at intensity of 1 to 1.5 with CM2.